Hey everyone, it's Dr. Adams with the Cleveland Clinic Chiropractic Group with some more home self-treatment ideas. Keep in mind that these are simply some suggestions of things to try. Make sure you consult with your physician before doing these on your own. Today we're talking about elbow pain. And keep in mind from our other videos, we have a very specific protocol that we like to use. First, we're going to address the soft tissues, that's the muscles and ligaments, the squishy stuff that's in the area. Then we're going to expand the range of motion doing some big three-dimensional ranges. We're going to stabilize those, and then ultimately we're going to bring some strength to it. So if we're talking about elbow pain, of course, there's going to be some very common presentations with symptoms. You might have medial or on the inside of your elbow. This is your classic golfer's elbow, or on the outside, that lateral side, which is your classic tennis elbow. Regardless of the side, try to take a bit of notice what your symptoms feel like. So quite often people will say, well, gosh, it hurts from here to here, and they'll use this sweeping motion with their fingertips. If this is you, what we're going to do is we're going to use the tip of the thumb. I like to bend mine like so, and we're going to just follow that line. If you find yourself going from the inside of your elbow down the length of your arm, well, that's what we're going to do. I'm going to take my thumb, and I use my hand kind of in this shape. I'm going to be pushing into the tissue with some pretty moderate pressure. It doesn't have to be very heavy. And I'm just going to follow that line, and I'm going to let my thumb do the work. This could possibly be tender as you're working through this. So if you experience some soreness, it's pretty common. Take it easy on yourself. You don't have to, again, go too heavy-handed. But I'm just going to take several passes along that line. Now, what I could also do is I could switch the direction of this. And if your hands are dexterous enough to do this, I might now just flip my hand over, and instead of going down the length of my arm, I'm going to come back up towards myself here. Okay? Now, let's say we're going to take 5 or 6 passes on that. Okay? Now, let's say your pain is more like you use your whole hand and you think, this whole thing is sore through here. Well, the treatment's going to be very similar to that. I'm going to take the whole palm of my hand, and I'm just going to act like I was squeegeeing down my arm, the length of my arm. So I'm just going to take the whole of my hand, and I'm gripping pretty tightly with my fingers, and I'm just going to squeeze this tissue all the way down. And maybe it's along the back of my arm here, and I might squeeze this tissue all the way down to my wrist and hand. And I would take several passes on that. Okay? Now, let's say you find yourself just kind of grabbing your elbow and flexing it, and it just kind of feels like there's some pressure in the joint itself. Now on this one, we might find that either some distraction or some compression would be helpful. So on this one, I'm actually going to take a grip. If you can see with the bend in my elbow, I'm going to go beyond that, and I'm just going to kind of pull this towards the other bones. Now, if this increases my pain, I'm going to go the opposite way. So I'm actually going to do some traction. Okay, so find the direction, whether it's compression or traction, find the direction that is non-painful for you. Again, it may be just a little bit uncomfortable, but what we don't want is a spike in our symptoms. So let's say it feels good to me to compress this joint. Well, I'm just going to continually compress this in multiple different directions. And all I'm doing is I'm grabbing the bones of the lower forearm and I'm pushing them towards this upper bone in my upper arm. And I'm just repetitively squeezing and pushing. Now, let's say that traction felt good. I would do the exact opposite. I'm going to take those bones and I'm pulling them away, pulling as if I were pulling away from that upper arm bone. Okay, so these are some of the common presentations for some of the soft tissue work. Now let's address the range of motion. Remember, we want as big an expressive range of motion as possible for the elbow. It's not just this hinge, which is the primary range of motion, but we also have this rotation of this bone on the side here, which is called the radius. So it gives us some roundness to the motion as well. So here's what we're going to do. We're going to start with the hand and elbow down at the side. And if you look at our other videos on the site, there is an elbow video specifically that talks about this three-dimensional range of motion. So if this looks familiar or it doesn't, you can also look back at those other videos. Okay, so what I'm going to do is I'm going to start with my palm up. You can't see it from the starting position, but as I move my hand up, I'm going to bend my elbow with my palm up. Once I get to the very top, as much as I can squeeze, and you can see I'm just bending my elbow, I'm going to now turn my hand and my entire forearm So now the palm faces down. And now I'm going to continue that range of motion with my hand in that position. And now that I've gotten here, again, I'm going to turn and bring this up. Palm down and send it down. Now, on this one, I'm going to leave my palm facing behind me, and I'm going to bring it up into that flex position. This time I'm going to turn my palm so it now faces towards my face and bring it down. So now we're just expressing that elbow joint through its entirety of three-dimensional range of motion. Now on these, remember, high volume is what we want. We want to do these throughout the day and never a whole bunch just all at one time. If you were, say, to do 30 repetitions of this, I'd rather you do it throughout the day rather than all at one time. Okay, now let's talk about some of the expansion of range of motion. So again, we're working right at this joint, and the muscles that are right in this joint around here also give us that pronation and supination, or palm down or palm up action. So notice this action here. So this is what we're going to do. Now I have a kettlebell here. You can use anything at home. You just need something that you can grip that's not going to move. Okay, so what I'm going to do is I'm going to start in the supinated position, or that palm up position, and I'm going to grab onto this kettlebell. Now, in this case, I'll turn to the side here so you can kind of see my arm. I'm going to straighten out my arm. I can do this from multiple positions, but in this case, we're going to do it from this arm straight position. So now, my action is actually going to be as if I were going to go from the palm up position to the palm down position. But what's going to happen is this kettlebell is going to stop me from doing that. So what I'm doing is I'm going to try to put myself in as much supination as possible, as much palm up position as possible. I'm going to grab the horn of that kettlebell, and now as if I were going to activate all of those muscles, and I'm really squeezing, now I'm really gripping through the horn of the kettlebell, and I'm trying to turn this over. And I'm going to hold that for a good 20 seconds. And I'm going to try to squeeze the entire time. And now it's as if I were going to keep a hold of this kettlebell at the conclusion of that 20 seconds, and I'm going to try to pull even further, as if I were going to go even further into that palm up position. Notice how nothing is actually moving. I'm just straining against the resistance as if it were. Okay, and again, I'm going to hold that for about another 20 seconds. And you might cycle through that several times, keeping this position. So let's review again real quick. I take my position, I squeeze all that muscle as if I were going to turn my palm down, and I'm just going to hold that in that position. Squeeze, squeeze, squeeze. As that 20 seconds concludes, I'm now going to go the other way. So as if I were going to pull even further into that palm up position. So all that stuff is activating on the other side of my arm. And again, I hold for 20 seconds. Now we're going to do the flip side of this under the same protocol. So this time I'm going to supinate as much as I can. And notice how I can get my thumb a little bit past just a flat palm down position. So this as far as you can go, great. If you can go a little further, that's where you want to start. So now I'm going to grab the side of this kettlebell because I have a little bit more pronation available. And I'm going to do the same thing as if I were going to bend this bar back this way, okay? So I increase my strength nice and gentle, but there it is. I'm now really contracting through there, squeezing, holding for approximately 20 seconds, and then I'm going to reverse that as if I were going to pour out a jug of water. Think of that action, right? So this is our first direction, that's the second direction. So there I am trying to pour out that jug of water. Again, no movement should be happening. It should just be the contraction of the musculature that we're working on, okay? Again, this protocol is great in that we address some of the self-myofascial work itself, and then we increase the range of motion, and then we're stabilizing it with some strength training type stabilization. Keep in mind there are several other videos on our website, so if this particular approach doesn't work for you, try some of the other protocols, including the wrist and the shoulder protocol. Thanks for your time.